Hello everyone. Topic for today's discussion is equipments used in ICU part 2. Pulse oximeter. A pulse oximeter is the device that measures and displays the oxygen arterial saturation. So this study is known as pulse oximetry. A normal individual on room air should saturate about 97 to 99%. A device is usually placed on the patient's finger, earlobe, toe or nose. So this is a fingertip saturation. This is a handheld method and this is a tabletop method. In the ICU, the pulse oximetry is used extensively on mechanically ventilated patients as it can frequently detect problems with oxygenation before they are noted clinically. As well as it also deals as a guide for weaning patients off ventilation, and it also helps in assessing the adequacy of a patient's oxygen therapy. So this continuous assessment has been a very instrumental role in introducing the pulse oximeter usage within the community and home care setup of patients, those who are suffering from variety of heart and lung disease and conditions. And also this is very extensively used during this pandemic. So how does this work? So the measurements are obtained by simply shining two wavelengths of light at the fingertip. So one is a visible red beam and the other one is invisible infrared beam. By measuring the light, it has been absorbed by the oxygen in the blood and oxygen saturation reading is established, and it is being displayed as a percentage of maximum amount of oxygen in the blood. Nurse's role. Choose an appropriate site, that is finger, toe, nose, forehead or earlobe with adequate circulation. Remove the nail polish or artificial nails if you are using a finger or a toe. Make sure the high and the low alarm rate for saturation and heart rate are approximately set. And the main don'ts are: don't apply a saturation probe to an extremity with an automatic blood pressure cuff, that is non-invasive BP cuff. Measurement, if it is there in either of the extremities, don't put a probe onto that particular extremity. Do not apply an adhesive tape to the sensor to fix it. Next, capnography. What is capnography? Capnography is defined as a continuous monitoring of carbon dioxide concentration and its time as a gas mixture. Capnogram. Capnogram gives you the tracings of the waveforms which are being obtained on the monitor screen. Capnograph. Capnograph is the machine that generates the waveforms. Capnometer. Capnometer is the device that performs the measurement and displays the reading in the numerical form. Let's discuss about this in detail. This is the capnograph. So it is the measurement of both EtCO2 value and a capnogram, that is the carbon dioxide waveform, and the reading will be displayed in the monitor. So it is measured by a capnograph. This is the EtCO2 value which you can see here. This is a capnometry reading. So measurement and display of EtCO2 value with no waveform. Here you can see in capnography the waveform, whereas in metry you will not be seeing the waveform. So it is measured using capnometer. are the uses of capnography? It assists in confirmation of intubation, mainly during intubation. This is used in a patient. Continuous monitoring when the ET tube placement during transport of patient, maybe for CT, MRI if you are going to move the patient or if you are going to mobilize the patient for any other scans, then you may require this capnograph monitoring. Assess ventilation status, to assist in assessment of perfusion and to assess the effectiveness of cardiopulmonary resuscitation and also to predict critical patient outcomes. Capnography versus pulse oximetry. So here we see the major difference. Capnography provides an immediate picture of a patient condition, whereas pulse oximetry gives you a delayed condition of the patient. So capnography will show immediate apnea, while pulse oximetry will show a high saturation after few or several minutes. This is about the capnography. Mechanical ventilator. Mechanical ventilation is a treatment to help a person breathe when they find it difficult or unable to breathe on their own. So, for this, a mechanical ventilator is required, which helps in pushing airflow into the patient's lungs to enable them breathe well. This is the mechanical ventilator. So mechanical ventilator is a device that simply pushes in air and oxygen into the lungs and removes the carbon dioxide from the lungs. So this function will be effective with a breathing machine. So this is the mechanical ventilator. There are different types of mechanical ventilator. This is servo, this is macket, this is dragger. So various machines with a particular purpose to be served, that is to provide air and oxygen into the lungs, and it helps in removing the carbon dioxide from the lungs of the patient. What is the purposes? The air is delivered in patients with compromised ventilation. This also oxygenates the different organs of the body to expel the carbon dioxide in the lungs, as said earlier. So it also provides comfortable breathing pattern to patients experiencing shortness of breath, and it helps in patients those who are seriously compromised ventilation, such as in comatose, that is coma condition, brain death or brain damage, patients with spinal cord injuries. Let's see what are the indications of mechanical ventilation. First thing is continuous decrease in oxygen level. Second thing is increase arterial carbon dioxide levels. Persistent acidosis, when you do or take an ABG, that is arterial blood gas analysis, you will find the persistent acidotic level of the patient, respiratory failure, cardiac insufficiency, that is the work of breathing is very less, neurological dysfunction such as apneic state or comatose patient with GCS less than 8. Let's see some ventilator terminologies. AC is nothing but assist control ventilation, where half will be supported by the patient. Volume controlled ventilation, that is VC. T bar C is a time controlled ventilation. IMV, that is intermittent mandatory ventilation. SIMV, that is synchronized intermittent mandatory ventilation. BiPAP, The word itself indicates bi-level or biphasic. So here, non-invasive pressure ventilation with pressure support, which consists of two levels of pressure. That is why it is called as BiPAP. PRVC, that is pressure regulated volume control. CPAP is continuous positive airway pressure. Continued. PSV is pressure support ventilation. NIPPV, that is non-invasive positive pressure ventilation. PIP is peak inspiratory pressure. FiO2 is nothing but the fraction of inspiratory oxygen levels. PEEP or PEEP is a peak end expiratory pressure. So there are three types of modes. Here, both the ventilator and the patient work together to perform the respiratory cycle. They are pressure cycle modes, volume cycle modes, and time cycle modes. Let's see what are the complications. The complications related to ventilator are VAP, that is ventilator associated pneumonia, that is infections, pneumothorax, lung damage, and side effects of medications. There are some side effects of medications. Because of the sedatives, the patient may be in apneic state or calm. So we have to take care of those things. What is a nurse's role? As a nurse, we must be aware to promote effective breathing pattern, promote adequate gas exchange, improve the nutritional status that the body is requiring when the patient is on the ventilator, prevent patient from developing pulmonary infection, prevent patient from developing problems which is related to immobility, and you should keep in mind as a nurse, never ever silence the alarm until the cause has been ruled out or after the investigation is done and it is being rectified. So never put off an alarm. If the source of the alarm cannot be determined, disconnect the patient immediately from the ventilator. Use a handheld resuscitation bag, that is your ambu bag, for manual ventilation with 100% oxygen until the problem can be resolved. Next, infusion pump. Infusion pump is a machine that carefully controls the rate at which IV fluids or IV medications are given. These pumps are reliable. So mechanical problems are possible in this machine, but it is very, very rare. If the IV infusion pump does not work correctly, an alarm will give you an indication. Purposes. So the rate at which IV fluids and IV medications are given needs to be closely controlled or monitored. Nurse's role. Using aseptic technique and universal precautions, IV infusion should be set for the patient. Set the flow rates as prescribed, calculating the amount of fluid exactly what should be delivered. Observe for the signs of infiltration or other complications such as thrombophlebitis, fluid or electrolyte overload and embolism before starting your administration. Next, crash cart. Crash cart is a special cart with drawers. You can see it here, which contains emergency drugs and equipments which is needed when a cardiac pulmonary arrest occurs. To resuscitate, this crash cart is very, very essential, which has all the primary drugs which is to be used for the patient. So this should be easily accessible to the patient area. Purpose. This emergency equipment is used only if the patient's heart or lungs stop working. Next, the cart is brought to the patient's bedside when the patient's heart or lungs are failing or have failed. Nurse's role or policy in handling the crash cart. Crash cart must be checked by head nurse or the staff nurse of every shift and to be documented in the checklist kept on the crash cart. Standardization must be maintained then and there. Defibrillator will be checked by biomedical department regularly or as necessary and check for the working condition of the defibrillator every day. Crash cart item must be checked monthly for expiry dates and expiry drugs. Each unit will have a crash cart placed in an easily accessible location where the emergency arises. Follow is a maintenance routine that should be completed at least every month. That is, expiration dates on medications and expired medication should be removed and replaced with the medications which is not expired. The defibrillation pads on the AED or the defibrillator should be checked for expiration date as well. The battery charge on the monitor and the AED should be checked and documented every day on the checklist in each shift. Next, defibrillator. So, a defibrillator is a device that is designed to pass electrical current through a patient's heart. The passing of electrical current through the heart is known as defibrillation. A defibrillation is done through pads placed on patient's chest. So it can both monitor and regulate the heartbeats of the patient. You can see the various types of defibrillator. It will be placed like this and the shock will be delivered. Purpose of the defibrillator. So it is to apply a controlled electrical shock to the heart which leads to depolarization of the entire electrical conductive system of the heart. So abnormal heart rhythms can be treated with medications while the other heart rhythms need to be treated with only defibrillation. It is a life-threatening heart rhythms then need to be immediately defibrillated in a scheduled fashion. So this defibrillation may be done using a manual defibrillator or the automatic external defibrillators, that is AED. Complications. What are the complications which will arise? Here, the defibrillator pads may cause a skin irritation to a patient and leave a temporary reddened area where the current shock has been passed. So, unfortunately, defibrillation does not always return the patient's heart rhythm back to normal. So, this is the complication. Skin irritation will be there, temporary redness, and sometimes the patient cannot be retrieved. The abnormal heart rate rhythm would be there. Nurse's role in handling defibrillator. First, put the patient in the comfortable position and take a 12-lead ECG. Give 100% oxygen by inhalation. Then, apply electrode paste on the DC paddle. Rub it and apply the paste, that is paste or jelly, at the patient's chest in the second intercostal space at the right side of the breastline and at the apex of the heart. So the electrode, where you are going to place? It is in the second intercostal space at the right side of the breastline and at the apex of the heart. Turn off the oxygen to the patient as a spark from paddle could blow the oxygen on fire. So always make sure you put off or turn off the oxygen what the patient is getting. Be sure to say all clear, I clear. No one should touch the patient or the bed during the cardioversion takes place. Okay, and then check the rhythm on ECG monitor. Keep the patient in comfortable position and give 100% oxygen by inhalation. After which, record and report the procedure and clean the paddle area with spirit swab. Next, again, keep the defibrillator for continuous electrical charging. As a nurse, you must make sure that these steps are followed while the shock is being delivered to the patient. Equipment maintenance or maintenance of equipments. Hence, dealing with critically ill patients. The equipments play a vital role as discussed earlier, so the equipment should be always in a condition to use. For that, it should be properly maintained and periodic checks should be done. Hence, it's used for life support and resuscitation, either it is working or not. So, periodic checks should be taken frequently. Staffs in the ICU should perform daily checks on equipment and inform the biomedical engineering staff when the equipment needs maintenance, either repair or replacement. To summarize, till now we had discussed about the equipments or devices which is used in treating critically ill patients or to stabilize the critically ill patients, such as pulse oximetry, capnography, mechanical ventilator, infusion pumps, crash cart, defibrillator, its uses, its purpose, complications and indications, and the maintenance of equipments. Hope you understood the topic. Thank you.